This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
It is a very special Health Watch today as we celebrate the birthday of Dr. Molly Fantasia, who is living proof that, yes, you do the right things, and here you are. Another birthday.
Well, I don't know how much that's true today, John, given that Dr. Molly Fantasia has a head cold.
Yeah, and interesting that you mentioned, I'm thinking to myself, I don't get colds, you don't get colds. And you said, you know what, I'm so busy, I've skipped my own IV.
I have skipped my own IV for the last 3 months. So let me tell you, as far as I'm concerned, this is proof positive. I'm getting back in the chair.
Okay. So you will be this week.
Yeah,
definitely.
You know what, John? All my staff, they make sure they get their IVs, okay?
Yes,
they do, and that's wonderful. And I want to do it too. This is crazy.
It's the shoemaker with holes in her shoes.
Yeah. I laugh about it, but it's true.
Okay. Thanks. Good to have you with us. As always, Health Watch, Sundays, 8 till 9, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. What do we discuss on this program? We discuss the who, what, when, where, why, and how of Innovative Medical Associates, how it can relate to you, and how it can help you and anyone you know improve your quality of life. That's our mission statement. And, of course, we welcome your participation during the course of the show at 855-839-1210, 855-839-1210. That is our number here in the studio. Good to have you with us as always. And, it's interesting. We're going to start on this because we always talk about the immune system and keeping it up and preventing certain things like colds. So let's talk about what you do on a regular basis, and you're going to be compliant this week.
I am going to be compliant this week. One of the things that separates us, I guess, from most primary care clinics is that we believe that we want to use the least amount of medication to effectuate the change you need for your medical challenge. But our real focus is on your quality of life. And one of the things we know in order to do that is to improve your own immune system. And I will tell you, John, I have a history of some other much more challenging than what I have today.
Right.
Okay. So this is like a drop in the proverbial bucket. It's nothing. But I will tell you that it just goes to show that if, you don't follow your own advice, which is I need to make sure that I continue to keep up my reserve. So, thanks to many of my patients and this show, I've been seeing more and more people. So I've had less and less time to take care of myself and put myself in the chair. I will tell you, though, my staff has been on me to make sure that I do it. And, of course, I just, go through it. But that's a side note. But the most important thing is the use of hydration to really effectuate the change for people. And why do we use it? Because we can use natural substances that their constituents can actually help you through a particular challenge or really maintain your own immune system.
We should mention, and also it's significant because it's your birthday, we should mention that you started this journey as a result of a major health challenge.
Exactly.
And you were told, well, you got to do this, you got to do that. And
I wasn't.
You said, no, I'm not going to do that.
Listen, the scientist in me knew that the whole point of what we do is to help people maintain a quality of life because every day there are new breakthroughs coming through in conventional medicine. And I would like to be around for all of them. And that's the point. And I really want my people to also be around for them. Now, I have a lot of cancer patients,
yes.
A lot.
Yes.
So I meet a patient exactly where they are. I have patients who want to do chemo, want to do radiation. But, I've always said, let's do the surgery. Get it out. If you have a choice, get it out. Obviously, if you don't, that's another problem. But honestly, John, there are so many new developments in cancer treatments that isn't it wonderful to help people maintain a quality of life while they go through them? And that's something I can absolutely say with assurance we are doing in our facility.
We should mention that with Innovative Medical, it's the hydration is the cornerstone of what you do.
Exactly.
And in those hydration bags, as we like to say, are different things for different patients. Different protocols, you call them.
Different protocols, recipes.
And these things take the place maybe of prescription meds or augments or what?
It can augment prescription meds in some cases. For example, we've had tremendous response for lipids. People come into us with high cholesterol, high triglycerides. We have a tremendous protocol that can help reduce your lipids and possibly help you reduce your need for statins or any of those category of drugs, or at least reduce the dosing of those, thereby helping you eliminate some side effects.
Interesting, as you know, I spent the week I was away and visiting some friends, and the one friend said to me, he said, "I can't believe how good you look for 72." And my other friend, who is 60, looks like he's 85. So it's just, I guess it's a testament to what you do.
Well, thank you, but it's also a testament to other things. For example, you and I both know we've got to improve our lifestyle, and this is one of those things that can help you do that. For example, lots of people who are our age, and by the way, I'm a little older than you, but
just
we're not
a couple years.
Yeah, that's right. But you know, we fatigue more easily than when we were 50. I mean, let's be honest, right? Well, what do you think the hydration can do? It can actually give you some more energy, so that you then can not only do your particular profession, but you might actually get out for a walk. You know, that's something I like to do. I like to walk. That's my my exercise. So, you know, these are the things. We want to help people with their lifestyle. We want to help you with what you're eating. We're big believers in organic. I'm not the food police, but we say, you know, if we can do organic, you try to do that. If you can limit some of the red meat for some of our issues, you do that. But again, this is the kind of thing we try to help our patients in every single manner that we can to improve quality of life.
You know, one of my challenges is diabetes, and the last blood work you did, your barber came up to me, shook her finger. You know how she?
Yeah.
She said, "You better watch that sugar."
Watch sweets.
I've been cutting down.
You know what, John? Your thing is you do like some sweets, and that's okay.
Yeah.
You know, but the idea is, and you know, the old thing about diabetes was you cut out all sweets. Well, that's not necessarily so. But what you do is you cut down on them. You use your appropriate medication, and you use the rest of your diet, and hopefully you come in and take a couple of drips from us.
Well, that's what I do every week.
You bet. You bet.
So, and in fact, I feel it that I missed it this week. You know,
I know.
You kind of feel different.
Well, I'm telling you, I know. Listen, I'm living proof that you got to do it.
Yeah. So what can people expect? Because I know you've met a lot of folks who listen to the show, and they come in, and a lot of times, even though they've listened to us, they're not quite sure what to expect. What can they expect once they start? Well,
once they start, first they should come in for the free consult. And at that point, we can get a handle on whether we might be able to help you or not. I mean, obviously, if you have bad kidney functions, we have to do your particular hydration very, very carefully, and we can. But we can outline what we need to do for you based on that particular consult. Afterwards, you expect to get some blood work, expect to sit in a chair, and then we'll develop the game plan for you. Could be once a week, it could be twice a week. Sometimes with the cancer patients, we need to do 3 days a week. It really depends on where you are in your continuum of care for your particular challenge.
We are coming up on our first break of the morning. Our program is called Health Watch. You'll find us here every Sunday, the live version, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly, or you want to run by her a medical challenge that you may be having, or someone you know? Well, this is the time to call, 855-839-1210. as I always mention, early is the best time to call because we have plenty of time to talk to you. All right? 855-839-1210 with Dr. Molly Fantasia. I'm John DeMasi. We both return. More Health Watch after these words. And we're back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. They are there every week. When we're here on the radio, they are there, and they're happy to talk to you at 856-489-0505. That's 856-489-0505. And don't think that when we go home at 9 o'clock, they do. No, they stay there, and they're there all week, okay? So 856-489-0505. Innovative Medical Associates, Marlton, New Jersey, and the website, innovativemedicalassociates.com. A lot of good information on that, and it is constantly updated. So if you checked it last week or the week before, you may want to check it again. innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And our show is Health Watch, Sundays.
Hi. Okay.
That's what we call.
You know what? That's
technical,
let me
technical
tell you,
difficulties.
That was most appropriate for my birthday. The gremlins are working
That's
here.
right.
Okay.
Well,
All right.
something happened, but we don't know
Okay.
what. But
All right.
anyway, take two.
Okay.
Let's talk to Pam in Marlton. Pam, good morning.
Hey,
You're on
Pam.
Health Watch with Dr. Molly.
Good morning.
Hi, Pam.
Hi, Molly. Hi, John. It's Pam.
Hi, Pam. Hi. How you doing? How you doing? It's good to talk to you.
I wanted to wish you a happy,
Thank
healthy birthday. Many, many, many more years here.
Thank you.
You know.
Thank
you. Know
you.
How we feel about
I know
you.
that
we love you.
you know, I know that. I know that, and I love you guys. Let me tell you, it took everything. You know, I left the office a little early on Thursday,
I know.
and I really
missed
didn't
you.
want to do that, but I knew I had to. I knew I had to in order to get myself together here.
Yeah.
But
Well,
you
I'm
know
glad
what?
you did.
This just goes to prove what. Thank you. This goes to prove, Pam, though, what I should be doing as well. You guys all do it, and I'm like the shoemaker without shoes, man.
Always.
You know
That's
that
right.
deal.
I
Right?
know.
Yeah.
And I'm glad
anyway,
that you said you're going to start
I have to
doing
tell.
that, doing your IVs. Yes.
Yeah, you bet. You bet. Listen, I want to tell you, that I was actually out with one of the consulting physicians that I use, and I was so relieved to get some information about one of your family members. One of the things we like to do is help any way we can in
Yes,
terms
do.
of
Yes, you
helping
do.
our patients get to the right things, So,
Yes, you do.
and Pam's a wonderful, wonderful patient in that she never misses her treatment protocol. And Pam, tell him you're a cancer survivor for how long now?
Yeah.
God bless you.
21 years. 21 years. And I've been with you
God
for
bless
13.
you. And I know that. And you know what's interesting? Pam had the surgery, right, Pam? This is one of the things I'm pushing right now. I have a young patient who's refusing the surgery because one of the doctors that they went to see said they couldn't do it. And you know what you and I believe. We find somebody who can do it, right?
course.
Do what we have to
course.
do, and
Yep.
then come and see us, right?
Yes,
God bless you. But
exactly.
you also
Yeah.
you also do you are very, very, very particular about your diet, which is another
Yes.
thing we were talking about, John.
I
and
try.
So
Not perfect,
that's
but,
important as
you
well.
know, I try.
Well, let me tell you, if you're not perfect, you're darn close to being perfect. So God bless you, Pam. Thank you so much for the good wishes. You hear me?
Pam,
Thank
thanks.
you.
Thanks for the call. We appreciate it.
Yeah, that's a good deal, John, to say. When patients take control of their own health as well as seek out the proper physicians, scientists, etc., they can live a long and healthy life.
Interesting, and you've often told Pam's story here on the show.
Oh, my gosh, yes.
That the story was she had the surgery, as
Yes,
you said,
yes.
breast cancer, and then they were recommending the chemo and the radiation.
Yeah, but she's smart.
And she said, well, wait a minute, what part of this is not toxic?
Yes.
And they didn't answer her.
Right.
So basically, she didn't do any of that and came to you, and the
Well,
rest is
well,
history.
you know, she's a smart lady, and again, I'm going to tell you, her lifestyle helped a lot in that condition. Her lifestyle was very, very important to that. But you know, this is what I see. My patients, for the most part, are very intelligent people and understand what is necessary for them when they leave the office, when they leave our facility. What is necessary for them to live a good life, and that's really key, John.
All right, 855-839-1210 is our number here in the studio. Again, if you have a question for Dr. Molly or a medical challenge you want to run by her, or you want to just call in and wish her a happy birthday, feel free to do that as well. 855-839-1210. We're going to stay local here for the moment, Dr. Molly, and talk about the Perlman School at the University of Pennsylvania.
Yeah.
Professor Morrissey and what he studied.
Well, actually, he's one of the professors in the school at Perlman School of Medicine. And he actually is a research doc. And what he found was he actually saw some types of cells that were not normally found, or they weren't really discovered in the lungs of ferrets. Now you laugh and you say, ferrets, I just want to wear them, right? Or
right.
No. This is actually, they're similar to human cells. And what's happened is that scientists came to the conclusion that most mammals, whether small or large, all have these new particular cells that were actually labeled RAS cells in their lungs. The reason why I'm talking about this is the RAS cells, or new organs, are like stem cells, and this is exactly what he's saying. These are called blank canvas cells. They can identify these new cells inside the body, which repair the damaged cells that are there and create new cells so that the flow of gases in the blood remains correct. I want you to think about that piece. And by the way, folks, you can look this up. You can Google it. I found it on two of the scientific journals, and I have the full journal article. But these RAS cells secrete particles which act as a layer for fluids flowing in and out of the small bronchial tubes in our lungs. You know, this helps increase the lung capacity. I'm starting to think that our approach for the post-COVID people actually enhanced these RAS cells. And what has happened is I think that they help move them, as well as the progenitor cells that we were able to deliver, which we do. I think together they help improve the lung capacity. Now, I can't prove it. This is a theory. But in reading this particular article, by the way, they found this out in the latter half of 2020, but the research wasn't published till lately. And I'm thinking that this could be a big breakthrough for COPD caused by smoking or environmental toxins. And I'll tell you, John, it's one of the things that I've definitely seen has been working with the progenitor cells that we deliver, that we extract from cord. And I will tell you, we're seeing tremendous improvement in people's lung capacities.
You were telling me that this discovery, it's like a blank canvas.
Yes.
And that's very interesting.
It's like stem cells.
Right.
It's absolutely like the stem cells or the progenitor cells we talk about. And what I find interesting is that, of course, I have to tell the truth. I see many studies, and I did many studies on these progenitor cells, but I hadn't run across this particular article. But I did know that stem cells, when delivered through hydration, their first pass is through the lungs, which I automatically assumed would possibly help improve people who had function problems, etc. And the whole group that we've done here in our facility. Frank,
welcome to the show.
How are you, Frank?
Happy birthday to you.
Frank?
Happy birthday to you.
Thank you.
Happy
Thank you.
birthday,
Thank
Dr.
you.
Molly.
Thank you.
Happy birthday to you.
How are you?
Happy birthday, Dr. Molly.
Thank you, Frank.
That's all I
I'm
wanted to
doing
say.
well.
You're the
I'm doing
greatest,
well. I'm
and happy
glad to
birthday.
hear
I wish
from
you
you.
the best.
Thank you, and God bless you. You know, I wish you the best too, because I know you've had a long road to toe. I really know that you sound pretty good, Frank. So I hope things are going well for you.
They changed my IVG 2 weeks ago from Actigam to Privigen, and so far no changes. Nothing's happening.
Well,
nothing's happening.
Well, you know, Frank, you're always in our prayers. You know, you have a very unique situation, and you're in our prayers. And whatever we can do to help you, know we will. And may God bless you
Dr.
too.
Mike. Take
Frank.
care. You're the best.
And thanks for the good. Thank you.
Thanks
for the good wishes.
Thanks for calling in,
Thank
Frank.
you.
Appreciate it.
Thank you.
All right, 855-839-1210. Nice that people call in.
Oh, that's very nice.
We were talking about this this study from the University of Pennsylvania, the Perelman School. You seem to be very excited about this.
I'm very excited about it because I wonder how many more discoveries we're going to find in other particular organs in the body. We don't know yet. I mean, this is the thing. To just see something that God has placed in our lungs that we know we can improve upon is just a wonderful, wonderful thing. So, I mean, when you look at COPD and the ravages that COPD has done, it's just incredible. And again, I can tell you that when we deliver the progenitor cells through hydration, we have seen improvement in lung function. That is the very first pass. When you deliver an IV, that is the very first pass. The idea is, all the time was, can we get the cells small enough to go through them and then go around the rest of the body, circulate to where we need them? And I have a couple other cases that I can talk to you about.
We're going to talk after the break. We're going to talk about other cases, and really one of the cases, and stay tuned for this. I mean, what you told me before the show, this is amazing. I mean, this is really amazing.
And again, this has to do with the 21st century type of utilizing the progenitor cells that we've extracted and that are extracted. I use a very excellent company that we've extracted, and I have the wonderful physicians who results that we're able to do with this.
All right, we're coming up on our halfway point of the show, which means you still have plenty of time to jump in here with a question for Dr. Molly Fantasia. 855-839-1210 is the number here in the studio, 855-839-1210. The show is Health Watch. You'll find us here, the live version, every Sunday, 8 till 9 on Talk Radio 1210 WPHT. Again, the number, if you got a question for Dr. Molly or a medical challenge you want to run by her, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates, and that number is 856-489-0505. When you call, you can get more information, and most importantly, you can schedule the initial consultation with Dr. Molly, which is complimentary. All you have to do is call and schedule that at 856-489-0505. 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website, as I always say. A lot of good information on that. The show is Health Watch, Sundays, the live version, 8 till 9, Talk Radio 1210, WPHT, and Dr. Molly Fantasia is here, 855-839-1210, our number here in the studio. We should give an update on your doc, Dr. Pat.
Oh, man. She's like a new woman.
I mean, that was like, they used to have those old Twilight Zone episodes where they had the people before, and then they put them in this machine, and they come out and they look brand new.
Yeah,
that's what this was like.
She looks pretty darn good. And again, you know, she'll be the first to tell you she suffers from MS. And listen, she does the conventional. She's a physician. She's always going to do that. But boy, oh boy, does she love this medicine. And it really shows. It shows on her face. Her come on in on a Tuesday, you'll find her there, and she's doing really well.
Yeah, that's right. And I saw her last week.
Couldn't
believe it was her.
I know. All right,
855-839-1210. I want you to talk about this particular patient. And what you told me before the show is really fascinating. And it goes to show when people say, does this work? Well, here we go. Your dementia patient. And
Yeah.
You were talking about
Now,
that.
she's been with me, I guess, approximately 4 weeks. And Brenda, she came from South Jersey. Really nice people. Her and her husband or her partner were referred to me from their chiropractic physician, by the way, who is also a patient of ours. And really, she's confined to the wheelchair. She pretty much was nonverbal when she came in. Now, look. We delivered the progenitor cells, okay? And again, these are cord stem cells. And I want to go back to what I said earlier. There are various ways to extract these progenitor cells. The idea is the technician here, meaning the physician who's using these, as well as the scientist who's helping with these cases, how you use these cells. Where do you get them? You can get adult stem cells from your bone marrow. They get it from your hip. You can get it from fat tissue. There are embryonic stem cells. I think that there's some challenge around that in the USA. And then there are the cord stem cells. In this case, we had used the cord stem cells because we read the research showing that in other countries, they were doing this and getting extremely good results. So we delivered the stem cells to her a few weeks ago, or the progenitor cells, and also the cytokines, the growth factors, that kind of thing. Anyway, she left. The following week, they came back, and he said, "Oh, well, she said a few words, right? No problem." The following week after that, we delivered some more of what we consider watering the garden. So we give her all the things necessary for these stem cells to set and grow. It's like watering your garden or putting the fertilizer on the garden. Anyway, she came back this past week, and she actually put together a sentence. Now, I'm not saying this stuff is holy water. You're not walking you're not jumping into the pool and you come back like Cocoon. You're not doing that. But what happened is her husband he said to her, "I love you." She returned that by saying, "I love you too."
Which is very significant.
Absolutely.
Because
she was nonverbal
right.
4 weeks ago, okay? So, these are the kind of breakthroughs that we see. Also, I believe my lovely Linda said something to her when she was taking a blood pressure, and she answered lovely Linda because Linda told her about her hair, things like that. And she said, yes. And these kinds of things, these are important breakthroughs. I'm not saying this is a complete breakthrough. We've cured dementia. None of that. We aren't saying that. But if we can improve the quality of life for her, and more importantly for her partner,
yes,
we've done something good.
What you're saying is progress. That's
right.
That's what it is.
Exactly.
Okay. We're going to the phones, Dr. Molly. Jackie is in Tacony. Jackie, good
Hey,
morning.
Jackie.
You're on Health Watch with Dr. Molly.
Good morning, everyone. I want to
Jackie?
say happy birthday to my great friend and great doctor from Seminary
Jackie.
and the kids.
Yeah, you're the best.
I just
my
want to
God,
tell
thank
that.
you so much. I talk about Tim a lot because,
Yeah.
if you heard my other segment, I'm extremely, extremely excited about this because now I can put my finger on what I believe is a theory here on why we believe these progenitor cells have helped the post-COVID people. And we need to work with him a little more, but I think we're going to get the old Tim right back in your arms, girl. So that's
It's
that is
amazing.
really our whole... Isn't it? It's just unbelievable. And I will say, thank God, and I thank all my patients like you guys for helping us do this kind of thing and to be brave about it because this is new data and a new frontier, so to speak. Right, Jackie? And hopefully
Yes, it
things
is.
are changing along those lines and we're going to do more and more of that. So I appreciate the call, and I'm going to be back in the pink this week, I think. Okay?
And we
Thank you,
appreciate
my
you.
dear.
And
Jackie,
Tim
thank
has
you for the
come
call.
100%. You guys.
Yeah, we're gonna talk about him in a moment.
Thank
Thanks
God.
a lot, Jackie.
Thank God.
All right. See, everybody's telling you, listen, get back.
Get back 180%,
get
right?
back to
They're not
where-
used to me.
Yeah, they're not used to you being down for the count.
No,
So
I was
you
only
gotta-
down. Hey, listen, I only left half a day Thursday. Come
well,
on, guys.
That's they depend on you. you
Right.
know?
Well, listen, I'm not the only provider there, okay?
855-839-1210 is our number. So speaking of Tim, he is your post-COVID long hauler.
Yes.
What has been done? What is
Right now,
happening?
well, of course, we've delivered the progenitor cells. And in his case, by the way, he was pretty serious. I mean, he was in the hospital. He had COVID like crazy. It was pretty scary there for a while. And he left on oxygen. He left the hospital on high meter of oxygen, as well as when he was in there. He was like in 40 or 60 units of oxygen, if you can believe this. But thank God, that's behind him, and he's walking around on room air. What we are attempting to do now is we found that all of these post-COVID patients tend to have their pulse ox drop when they exert themselves. Now, that's something that we think long haulers are going to have for quite a while. But what we want to do is we are working with some PT, a particular modality. We're going to try to get him back on all of his Nautilus equipment. So, but not yet. I'm saying that to Tim directly because I know he wants to jump right in because he feels that good. But you cannot. This post-COVID affects neuroendocrine, and all of those things affect your breathing.
You also mentioned physical therapy that you've been doing. That's
it's a
part
particular
of this, right?
form. It's a particular form because what we want to do is try to build the stamina up, but ever so gently. We're using something called the power plate, but it is a very specific type of modality. Nonetheless, what I'm saying is anybody out there who is a long hauler needs to be aware that you're not going to just come right back. It's going to take a little time, but can you? Absolutely. Also, the neuronutrition that we give you and the pulmonary nutrition that we give these folks really has helped. I have another patient who's wonderful, Susan. Actually was a very wonderful woman, had COVID as well, and she's doing very well on the nutritional, the hydration. And I will tell you that had a lot to do with vitamin C, some of the other amino acids that we're giving her, keeping her going. And in the end, John, what I'm saying is every patient is different, and every type of, although we have a generalized protocol for each and every condition, we really make it much more specific for the patient.
You should also mention the long hauler. That's the long-term effects of COVID, right?
Right, and it can last quite a while.
Yeah, so some people may still be having COVID. I mentioned to you my godson. He had COVID a year and a half ago. He still can't smell.
And he's a young guy,
and he's
right?
a young guy.
And I will tell you something. I would not be surprised that his testosterone level is low. That's one of the things I'm finding with the long-haul COVID men. So these are the things, John, we want to look at. And we do look at all of this through the blood work of all our long-haulers.
With a lot of these cases that you mentioned the dementia patient, and you were talking about Tim. Is this something where they're going to be in your chair for a long time? I mean, what's the expectations
listen,
of really getting back to normal?
Listen, I want to say something. Any type of chronic condition, whether it's autoimmune, whether it's neurodegenerative, whether it's cancer, in terms of our particular protocols, we have to build up that reserve. We talk about that all the time. So generally that takes between 30 and 40 treatments of some kind, okay? Then what you need to do, just what I didn't do, is you have to come back and do your follow-up. That could be once a week, that could be twice a month, or once a month, depending on where you are when we end the 30 to 40 treatments. That's the important thing, John. Very, very important.
I guess what you're saying is, and you're living proof of it today, you can't stop. You can't stop completely.
No, you can't. Listen, I don't want you to go steady with me. Did you go away this week?
Yes.
Of course. So I want you to live a good life. I want you to have quality of life outside my chair, for gosh sakes.
Of course, yeah.
But the thing is, we have to be aware of our bodies. People who go through really debilitating kinds of conditions, right? Or have conditions that affect them on a long haul, like MS, like lupus, like rheumatoid, know when they're feeling more fatigue, when they're feeling a little less than on the ball, this kind of thing. They don't feel quite sharp. They know when to come back. They know when to come back.
That's right.
And that's the important thing.
All right, we're coming up on our final break of the morning, which means you still have time to get in here with a question at 855-839-1210, or you want to run by a medical challenge, run by Dr. Molly, feel free to do that, 855-839-1210. That's our number here. Our show is Health Watch, Sundays, 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return, coming back with more Health Watch after these words. Back here on Health Watch, operators are standing by right now at Innovative Medical Associates, and they will be there after we leave you at 9 o'clock. They'll stay, and feel free to call 856-489-0505, 856-489-0505. What you want to do really is schedule the initial consultation with Dr. Molly. That is complimentary, and that's where you really can get a lot of your questions answered and a lot of information that you would need, and then you can make a decision as to whether this is for you or not. It's pretty simple. 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, you miss any of today's show, we have our Health Watch replay this afternoon, 4 until 5, here on Talk Radio 1210 WPHT. A couple of minutes left of the show. You want to ask a question or run a medical challenge by Dr. Molly, 855-839-1210. Very interesting what you're going to be doing this week, Dr. Molly. You're injecting... You're doing stem cells in this knee?
Here, we've been talking about regenerative medicine for most of this show.
Right.
Right? And so people are familiar with the injections for regenerative medicine. And when they think about using these progenitor cells, they generally think about it as an injectable. And okay, that's cool. And we are doing that this week. We're going to be injecting these particular cord progenitor cells directly into the ACL. Now, Dr. Pat, was and is an anesthesiologist. Can't say was because she's still one, She was doing anesthesia for 30 years, and I'm lucky enough to have her working with us. So she's actually going to be doing the injection this week. One of the things we're very excited about is this gentleman went to 3 other clinics before he came to me. And I can't even begin to tell you the outrageous fees they were going to charge for this. However, one of the things that I found very interesting, he goes to one of the biggest and the best in the area, and they told me he has a 3-week wait. And when he called me, I said, you know what? Are you kidding me? How can you? This guy was an athlete, a runner, and a pilot. I said, how are you going to hobble around on this for 3 weeks? And probably do more damage. It would seem to me, if you've made up your mind to do this, we will do it. We will get you in and out. We will follow you for the 4 to 8 weeks that need be. And at the worst case scenario, that these guys are still fooling around, you can always go back in. I had a very good consult with a orthopedic sports medicine certified physician who's a dear friend of the clinic and a dear friend of mine. And she said, "Are you kidding me, Molly? Do it. I'd be very excited to see what happens on this. And in addition, should there be a problem, there shouldn't be any reason why not to go back in. And given what you do with the hydration, we could probably get a really excellent outcome if that was needed. But I bet you're not going to need it."
So, in other words, there wouldn't be any surgery necessary?
Right. We're hoping that that's the case. We can't guarantee it, but we're definitely hoping that that's the case.
Because you hear this about athletes all the time.
Of
Torn
course they
ACL,
all. Yeah,
they're out for a year, or they're out for however long they're out for. They're out for a long time.
But you also hear many of them doing this regenerative medicine.
Yes.
And actually, the clinic he went to does it, and I think the 3-week wait is because he's got so many VIP patients that this guy got relegated to the bottom of the pile. You follow me? Because it takes, remember, no matter what we do, the healing properties of this is probably going to take the 8 weeks. But we would want this guy to be doing some physical therapy. We want him to be able to do the follow-up on this. In other words, we're planting the seeds. We have to water the seeds, fertilize the seeds. So there's a whole series to this for the next 4 to 6 weeks.
And how many times would there be an injection? Just the one time?
Just the one time,
Okay.
but there would be hydration probably 6 times after that.
This is going to be fascinating. And
Oh,
you'll
I
have
can't
to-
wait to report on this.
Yeah, I was just going to say, you'll have to keep reporting.
And look, the one thing about us, if it's not quite as successful as we want, we'll tell you. But the point is, I applaud him for giving us the shot. And more importantly, we've done several of these, probably about 10, that Dr. Pat has done, and they've been successful.
So there's a track record here.
Yes,
It's not like you're
yes.
just...
This is not the first one we've done. We have like 10 to 15 other ones that we've done. And
this
regenerative
medicine
today.
today, and it's fascinating. It seems to be more and more that this is becoming like
mainstream.
a trend. Yeah,
mainstream. It really is. And I will tell people it's worth a shot.
We have a couple minutes left of the show, and I know you wanted to talk about some of your cancer patients and your cancer support protocol.
Right.
Talk about that and what's been happening.
Well, very interesting. I have a retired physician in the chair right now, and he has prostate cancer, and he's not a youngster. And he says to me, "Hey, how much vitamin C you giving me there, Dr. Molly?" I said, "Plenty." And he started laughing. He goes, "Yes." He goes, "Let me tell you, I had to wrestle my my radiology oncologist who's telling me I can't do this." He said, "I read several of the studies that you did." He said, "There's no reason why I can't do this while I'm getting radiation." He said, "Because isn't it true you make that a pro-oxidant when we're doing it?" I said, "That's right." So vitamin C has the ability to become pro-oxidant as well as antioxidant. Because remember, they're creating free radicals when they're doing this. It's a question of when you do the vitamin C after the course of the radiation.
Bottom line, it's a good thing.
Absolutely.
Whereas some have said it's not a good thing.
That's right. It's how it's done and when.
And so he's not the only cancer patient. I
just used him as an example.
A room full.
I have a room full. But what I'm saying is he's a retired family physician, so he's not a dummy.
So
he knows.
he's got some experience, some knowledge of
Absolutely.
what's happening.
Absolutely. And I have a lot of cancer patients who are extremely knowledgeable who aren't in the healing arts.
And the main thing with the cancer, and you call it cancer support, is because the cancer can knock you out.
What are we doing? We're improving your immune system.
Right.
It's the same thing post. I had another wonderful patient of mine, Vita, who came back. She was doing several rounds of a different immunotherapy, which, by the way, those immunotherapies, don't be fooled. They knock your immune system to heck and back again.
Really?
Many times. So she was out for a couple of weeks. She did what she had to do. She's back in my chair, she said, and I couldn't wait to get here. That's good enough for me. Listen, we're not curing cancer, but we sure want to improve your quality of life while going through your cancer treatments.
And when you go through, and we had Pam in the beginning of the show was talking about, she's been with you for, 13 years. I mean, so this is an ongoing. It can be an ongoing thing.
Sure it can be. But you want to do it around the rest of your life. I mean, I'm not, again, I don't want to go steady with you. I'm not about that. But I know that I want to maintain your immune system. And that's the key. We must maintain our reserve.
And I always say this. I knock on wood. I never touched COVID because, I was in your chair twice a week.
Listen, I didn't touch COVID either, but, it can get us, right? We can get a cold. We can get a respiratory problem.
People telling me, you worried about COVID? I said, no, not really. Well, why aren't you worried? I said, well, it's called Dr. Molly.
Well, no, listen, I wasn't cavalier about it, right?
Yeah, no, you weren't. No, you
and
weren't.
That's what we want to be with everything, John. We can't be cavalier when it concerns our health because, guess what? If you don't have quality with your health, you have nothing.
And that is going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates, and they'll be there after we leave you at 9 o'clock at 856-489-0505, 856-489-0505. Check out the web, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget, if you missed any of today's show, check us out this afternoon. It's our Health Watch replay. This morning's show this afternoon replayed from 4 until 5. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses, Jess and Lana, and our medical assistant, Karen Kathy, I'm John DeMasi. Thanks for listening. Enjoy the rest of your day and your week. Have a safe, a happy, and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.